Hello, very good evening. This is Tanzila Jamar. Welcome to our show, Coping with COVID. I hope you are fine, though the difficulties is going on. Every week we try to bring amazing doctors, highly health professionals to give you inspiration. So this is the same way. Today is a Wednesday, but we coming 10 minutes before because we are a little bit, have some work to do. So let's see, we can come up early to give you some space. So thank you so much, all of you who always been with me and supporting us, our work. Thank you so much. Today I am inviting amazing Dr. YEMI. She is a health professional. She is working with the biochemist and she will share some her work, how she is going on in this COVID. Let's welcome to her. Very good evening, Dr. YEMI. Thank you so much for joining. It's been pleasure that you give us time. Thank you. Thank you so much.
Thank you. Thank you, Tanzila, for having me on this show. I'm really honored to be on your show today.
Thank you. So my first question to you, as even you are a doctor, you are the front line, you are the braver, you are the warrior for us. So we would like to know how about your life going on in this pandemic. Would you kindly share, please?
Okay. So I'm actually working in the private sector. So I work in clinical research at an American biotech company. So I'm one of the lucky ones. I actually work from home. So we work on products that drugs and clinical trials for patients with genetic diseases and also viral diseases. We are looking into how our drugs can help people with COVID as well. So I'm lucky. I've been sitting at home and doing most of my work. So, but anyway, the impact of COVID with my job, it's generally a lot of hard work. What I've really noticed, and for most colleagues that work in the private sector, biotechnology or pharmaceutical companies, we find we're doing work for 2 or 3 people because there's just so much to be done, so many tests that we need to do, so many investigations that we need to make sure we're doing, and it's all for the benefit of patients in the future. And other things that I think the impact of COVID on my daily life is generally, as we all know, we have all these narratives going on about, especially the conspiracy theories about COVID, which we would now call fake news. So things that are not scientifically, no scientific justification. So it's just for people to be aware that really things, before you absorb things in, make sure there's some scientific justification of why we have this COVID situation. Another experience we have with COVID is my experience is I travel less. My headquarters is based in Austin, in Texas. So prior to COVID, I used to travel like 2 to 3 months, every 2 to 3 months for an 11-hour flight. So now that has all stopped. So I tend to have more time at home, more time with family, and more time to meet with friends. And it's quite a relief not to do all that travel.
Thank you so much, Dr. Yumi. It's nice to hear from you. As you said, you are very lucky. I'm lucky too. At the moment, I'm working from home. But honestly, I think sometimes like it's boring because in job, when I go to office or go, I meet with government, school and different organization. I have a schedule, so I go and come like a routine. As now it's home, it's like whole day I'm working. And it's like it's kind of like there is no routine, like whenever I need to do, but in office at least 9 to 5, there is there is a good thing. Okay, so I want to know, in this pandemic, lots of people are dying and loved ones are missing, but do you think there is any positive impact, doctor? Do you
One
feel
of the positives, one of the positives that from COVID is the creation of the BAME Health Collaborative.
Brilliant.
Yeah, under the
we are together.
Yes,
That's why we are together.
we are
Great.
under the chairmanship of Michaeline Holden March. So she brought us all together, a group of healthcare professionals. She brought in Also people that work within the community, so people that have a passion for this community. And I work with clinical trials, so I deal with a lot of statistics. So for instance, I have my data here. We deal with a lot of data. So 20% of all nurses are from the BAME community.
Yes.
However, 65% of the deaths were nurses from the BAME community. So that's a really great difference. And 44% of all medical staff are also from the BAME community. And believe it or not, 95% of the doctors that died are BAME.
Yeah.
So this collaborative, we've come together to sort of look into why do we have these disparities with the BAME community? Is it because they're the key workers? That's probably likely. They're mostly key workers, bus drivers, aides, nurses. Or is it because they're the frontline staff? They're the ones that have to go to the front. Are they agency workers that have no choice and have to hide pre-existing diseases and do the work when other people do not want to do that work in the COVID wards? Or is it that the BAME community have these comorbid diseases? Which is one of the narratives that came out, which I really found quite annoying, I must say, that, they're full of hypertension, obesity, and all sorts of comorbid conditions, and that's why they're dying early, which is not the case. So I know the government have done a study and they're looking into why, and they've done a report as well. However, I know nothing has come out of that report. I think something that came out was one of the facts that lack of PPE by these frontline staff, which really was totally out of order. But it happened. I'm so sorry for the loss of lives of these brave individuals that came to save lives of people in the UK and all over the world as well.
Thank you, doctor. Thank you. Yeah, your mentioning is right. You're very remarkable. Yeah, in this pandemic, people frontline, they can see most of the BME. They die, the doctor, the nurse, and it's remarkable from our community. Honestly speaking, I think this is the time they can rectify. They can really mention and they can show their appreciation, praise that how BME contributed in this country. Like most of the time people are saying, "Oh, migrant, oh, immigrant." It's like some kind of lewd word they use people. And look at this, look at the pandemic, how BME, the people they're helping, they come to, give their life. And I think it's amazing. We need to really appreciate, we need to say, so I would like to say from our team, Skill Excellence, and from all of us, we would like to have a clap. Thank you. Thank you all from my doctors, your researchers, you're amazing professionals. Thank you, thank you, thank you. We are humble. We are so grateful for your generous kindness. You live your life, you leave your loved one home and you are working. I'm really from bottom of my heart, I'm thanking everyone, because maybe I can do that, how you do, guys, so thank you so much. It's amazing what you mentioned for BME collaborative. Thank you so much. Every time we got our professionals commenting, so today we are really early, maybe they don't know, maybe sometimes they will do the replay. Hopefully they will see later, they will watch and they will comment later, hopefully. So the last question, what will be the tips for audience from your side? What could be the inspiration?
Okay, first and foremost, listen to the Chief Medical Officer. There's a reason why he's the Chief Medical Officer of the UK. Practice safe distancing. So don't go to a party where there are 100 people. Don't do that. This is not the time to do that. Number 2, wear your mask and wear it properly. Some people I notice wear their mask and it's under their nostril, and I wonder why they bother putting it on. So wear your mask properly. Again, wash your hands at any time you go out, and because you don't know when you touch things. You in the bus, you touch the railings. You're in a supermarket, you're touching things other people have touched. So always wash your hands. And if you don't have water, access to water or soap, have a sanitizer with you all the time. They're really small sanitizers you can put in your bag and then have with you at all the time. Another thing is for the BAME community, a lot of studies have been done. We are mostly vitamin D deficient. Please take your vitamin D. They have the tablets, they have the spray. The spray is very easy. Put it in your bag and just do 1 puff a day, and that's fine. So take your vitamin D. And this time of the year, it's winter, it's cold. There are other viruses as well. We need to have our vitamin C with zinc. It's really very good and it protects. In addition, exercise. Just do 15 minutes a day is fine. You don't have to exercise and go on the treadmill. I mean, the gyms are open today, but they weren't open for some months. Exercise in your living room. I do these kukwa exercises, really good dance exercises. Do it for 15 minutes and you will feel good, the endorphins, and you really feel great with the exercises. Then breathing exercises, take a deep breath and out with your mouth. And that's really good. You do that at least for 6 times. And if you like, if you can, do it like 6 times a day or 6 times, do it, the breathing 6 times once a day. And if you can, but at least try to do it at least 3 to 4 times a week. So the breathing exercises, it helps you a lot. Another thing for the younger ones, develop yourselves. You have a lot of free online courses, learn a new language, do online course. A lot of universities, Open University, Harvard University, they do free online courses. Develop yourself, do project management course. And so by the time you go back to work and you're busy running for the train, running for the bus, you would have improved yourself and you have better educational prospects. And we know fully well that the BAME community as well, they have poorer educational outcomes as well as in terms of job prospects. Another thing that I want to stress, spend time with your family, your loved ones. We are locked in most of the time. Spend time with them, have good times. Those that are not in the same country, have Zoom meetings every week, every other week, and reach out to them. Reach out to them. Those that are hurting, those that need support, reach out to them. Friends, some friends have lost their jobs. Support them in whatever way you can. Talk to them. The vulnerable, talk to them. And finally, show kindness. Kindness is free. Kindness, it doesn't take anything out of you. Just be kind to everybody. Your neighbors, if you have extra toilet paper, for example, extra pasta, ask your neighbor. Form neighborhood WhatsApp groups, which is what we did here where I live, and just ask them, does anybody I have extra pasta? Does anybody want? And you'd be surprised. People would say yes and give them. So it's really great to be kind to everybody. It doesn't take anything out of you. Be kind. This is a time for us to think, look at what our behaviors, look at what we've done in the past, and just be kind to everybody. Change our behaviors and be good to everybody.
Thank you so much, sister. I can see a question for you. So one of the sister, beautiful sister Tahmina, she asked, if anyone tested COVID positive, need to be isolated for 14 days? My question is, after 14 days, how can we be sure she is recovered or he is recovered, still feel sick or coughing? I think it's a very good question. Thank you, sister Tahmina. Very good question.
That is a very good question. And ideally, what they found out is the incubation period. So you might still be ill, maybe not feeling too well, you might be tired, you have what we call long COVID now. However, you can't transmit the virus after 14 days. So that is the reason why. So you can't spread it. You still be ill, you might not, you're not infected. You are ill, but you can't infect other people. So that is why we've been giving that 14 days.
Wow, thank you. Even I learned now. Thank you so much, Tahmida. Even I learned now. Actually, why 14 days? Though they feel coughing or unwell. Thank you, doctor, for answering the question. I really appreciate. Here, Sister Miguelini, She's here. Thank you, Sister Mikulini. She's amazing. We spoke about you earlier. Maybe you heard and you replay. Thank you so much. And thank you for your comments. She's making a beautiful comment all the time. She appreciates us.
Yes.
And she's a lead for BME. She's the founder. So we're really grateful we got Mikulini having this initiative. Thank you, sister. Thank you very much. So do you have any other comments, doctor? Do you have any other comments? We are in the last hour show. Any comments,
Yes.
anything that you want to say, please?
Well, I think the BAME community, we should come together now and try to find a solution for all the disparities that have been occurring. And with the BAME Healthcare Collaborative that was set up by Michaeline Holder March, I think people that are involved should actually support this good cause, because it's not just, we're not here for fun. We're not a charity. These are people that are very busy. Michaeline is extremely busy. Professor Rotimi, Jayasimi, Trisha, George, and you yourself, Tanzila. We
Yeah,
are so busy.
honestly, so busy we are. Honestly,
Yes, we have a passion for our community, and
Yeah,
again, nobody's going to help us. Nobody's going to, we ourselves, we have to help ourselves, and we have the tools to help ourselves. So let us use it. Let us use our tools and help our community, because I think what's really hurt me a lot was the negative connotations about the BAME community, and we're such a beautiful community with beautiful people with beautiful hearts, and we contribute to the economy of the UK. So we have to do something for ourselves. And another thing, help our elderly. Help
yes.
our elderly. They are very vulnerable. We need to support them as well.
Thank you so much. What a beautiful message for everyone. I believe everyone love it. And you can see people are writing about you. Thank you. Rotimi say, thanks both of you for the great discussion. Thank you so much, Rotimi. He is amazing. Really, I appreciate you, all of you. Sister Mikulini, we must work together despite our gender orientation, religion, race, language, and culture to save life. Thank you. Yes, it's true. Thank you so much. Tahmida, is it share? Yeah, of course. Would you kindly share, Tahmida Abu? I really appreciate if you share. Thank you. Thank you so much. Thank you for your kindness. I can see beautiful message. Rotimi wrote, kindness is here free. Thank you. It's true. You are true, doctor. You said kindness. Moreover, kindness. Be kind to people. Thank you so much. Thank you. I can see here. Tishia, thank you so much, Tishia. Support of each other goes a very long way. It's true. Thank you, and thank you very much. Tahmida, can we get COVID more than once? Yes, he said, yeah, it
Absolutely,
could
yes.
be. Yeah. Thank you. Thank you so much. Very true, Tishia. Thank you so much. So, Mikulini, Tahmida, please share. Yeah. Thank you so much, Tahmida. Thank you so much, Mikulini. Thank you, Tishidia. Thank you, Rotimi. Thank you so much, all of you who joined. I really appreciate your time, your comments, your words. Really, it matters to us. Really, it matters. Really. Thank you so much, all of you, for being true souls, for being kind. Thank you so much, doctor. You have been wholly busy, but you are now with me. Thank you so much for your valuable time, your beautiful message for the audience. Thank you. I really humble, grateful for your all contribution. Thank you.
Thank you, Tanzila. I
Have
appreciate
a
it.
wonderful good night. Thank
Same
you.
to you. Bye,
Thank,
everyone.
thank you so much. Thank you. Thank you so much. Bye-bye. Bye. Thank you, Sister Mikulini. Tanjila, we appreciate what you are doing for BHG. Thank you, my sister. It's my pleasure. Actually, as Dr. Yumi said, actually, we all are busy. Whole day I was in work. I need to cook food for my son, my husband, my family. I need to, I need to give them dinner. They are waiting for the food. That takes me that they are hungry. So I need to conclude now. I wish could be more long, but we have commitments. So thank you so much for appreciating. I am really humble that you all appreciate my work, and I believe I will go more and more. Thank you so much, Rotimi. Few people have been known to have COVID a second time. Thank you. Thank you so much. Tahmida, thank you, Apu, to arrange this for us. Your kindness. Bye. Good night. Thank you, Tahmida Apu. Thank you so much. So, all of you make a wonderful comment. Thank you so much. Jahara Williams, thank you for joining. Great discussion. Thank you. Have a wonderful good night. See you another time. Goodbye from me. Bye-bye.